next week sees the first ever National Obsessive Compulsive Disorder Week, set up to raise awareness and public understanding of a condition that affects nearly 2 million people in the UK alone.
Well, joining us now are Dan Blackwell and his partner Susan Clark, who both have suffered from OCD since childhood and are still suffering with it now, and Katie Dath, who's an OCD therapist. Welcome. Thank you very much indeed for coming in. So Dan, let's start with you. You say that you knew even when you were little that you weren't, in your words, not quite right.
Yeah, I sort of tended to worry and be quite an anxious child, and this seemed to worry more than other people around me.
Yeah.
So I kind of, looking back now and asking my parents about it, they sort of said, well, yes, there was an underlying there, but they weren't quite sure they could put the finger on it.
And it was an ad campaign when you were 12 or 13 that sort of triggered it to a much greater degree.
It was, yeah. It was the big government campaign about AIDS. And I remember I was already sort of kind of hand washing then, and there was the intrusive thoughts, and all of a sudden they came on about AIDS and said it was going to be this massive pandemic that everyone was going to get it, and then they told you like how you might be able to catch it, and that was it.
Often it's getting, at least trying to understand, it's getting the name in when you realise that you've got something that other people have got, and there is something to understand, and that happened because you heard the lyrics to a song.
Well, the pop group Cardigans had an article in the News of the World Sunday magazine paper, and I read that, and I said to my partner then, I said, that's what I've got. I totally had empathy with it. So I took it to the doctors and said, look, this is what I've got. And they went, no, you're still depressed, it's fine. And I went, I want a psychological evaluation, and that's when they sent me. Within 15 minutes, the psychiatrist was able to diagnose me with OCD and told me what it was.
That was a huge relief for you, knowing what you had, and suddenly there were other people out there with a similar thing.
Yeah, I did feel great.
And for you, Susan, it was actually having your children, wasn't it, that made it. You'd had it before.
I had it as a child as well.
But to a greater degree when you had your children.
Yeah, because it was a contamination issue. The house had to be, spotless. I didn't want my kids catching anything. So yeah, it's pretty tiring.
And you had the intrusive thoughts as well.
I have had, mainly over my children, thinking that maybe I can't keep them safe. And I had this really silly one where I was sat in my car. I got in the car first. Obviously, I've got to let my daughter in. And I had a thought that I was going to drive off and just leave her there. And I know I would never do that, but it was always there, yeah.
Katie, is this treatable? I mean, what is, if you're living with this, what can you do?
Well, I think ultimately OCD is eminently very treatable and manageable, not necessarily curable as such, but certainly through seeking help, particularly cognitive behavioural therapy and/or medication. Some people, obviously Dan didn't want to take medication, some people find it helpful, some people don't want to go down that route. But certainly there's lots of things that you can do to make your life better and to manage the problem more effectively.
Somebody watching thinking, do you know, that's exactly what... And I think a lot of people, to a greater or lesser degree, a lot of people are OCD. You talk to anyone in here, we all have little things that we do.
I do it. I can be a bit funny about things sometimes.
Well, you tap.
I tap things. Lights, funnily enough, you can't touch light switches. I can't stop touching light switches. I have a real tap with things 3 times, everything in 3s. And I go through cycles. Sometimes it gets really bad, and my nan's not very well at the moment, and I find myself tapping loads of stuff. And then you sort of get out of it, and I have to really control myself and say, no, don't do it, don't do it.
So what would you suggest? Where do we go? What do we do?
Well, I think from what you're describing here, a lot of people have certain sort of superstitious behaviours and things, and they may or may not turn into full-blown OCD. I think one of the questions you have to ask yourself is how distressing is it, and how much impact does it have on your life? Because we heard from Dan and Susie, it's an incredibly anxiety-provoking and difficult thing to deal with. Often people will say, oh, is that the thing where people wash their hands a lot? And I think people recognise some of the compulsions, but they don't realise quite what's going on inside for that person and how incredibly difficult and distressing it is.
And how it affects every aspect of their lives.
Absolutely, yeah.
Well, thank you both very much for coming in and pointing it out. And it's fantastic that you've got each other. I mean,
I know. Really.
At least that's a happy ending to that part of the story. Anyway.
It certainly is, yeah.
Thank you. Thank you very much indeed.
Katie.